I think as people are joining, we can go ahead and get started. Just in case you just joined us, Jordan Frazier from Oregon Primary Care Association. I'm the interim Medicaid program specialist, and today we're having one of our public health emergency unwinding office hours in partnership with ODHS and OHA, and they will be presenting to us today. So I will not waste any more time and will hand it over to that team.
Hi, my name is Sean McNulty. I'm OHP's Member Communications Coordinator. Just a second to get the slides pulled up here. Okay, hopefully everyone can see now. Alrighty, well, welcome to the office hours. Thanks so much for being here today. We're glad to have so many people and familiar faces, or names and faces in the chat here. So to start us off, we've got our agenda coming up for today, renewal updates, OHP Bridge updates, feedback and future outreach, and then general discussion time. So if you have additional items to raise, please let us know at the end. Heading straight on in then. For renewal updates, we're going to be covering the unwinding updates so far. This is similar content to what we had in our unwinding webinar this morning. We'll be going into a little bit less detail here, but this is a question answer session, so we wanted to present that content again so people could have the opportunity to ask questions that we'll be doing it in truncated form. For if you're interested in this sort of thing and want some notice examples, that was available in the morning webinar as well. So the public health emergency unwinding is the renewal process that we've been going through since April of 2023. Just over a year in now, we are about 91% complete. Out of the renewals that are remaining, we've got 0.7% that are in process but have not been completed. Most of those are waiting the state's action, like the member has responded and we're reviewing their documents, something like that. Just under 1,000 of those are actually awaiting the recipient's response. That does not include the people who did not respond and have already been closed and the decision's been made there. Then there's another 8.5% of the total renewal population that was delayed and is going to be starting off in June. There's going to be 4 additional waves coming up between June and September when new renewal notices are going out to members that are affected by this unwinding process. So out of the renewals that we've completed so far, 80.2% or 81.9% of people are keeping their benefits on the same level. There's also an additional 1.1% that are keeping some form of benefit, but aren't, or it's a downgrade. So they might have had full OHP previously and are going to just a Medicare savings program, but they're keeping some form of assistance. Then for 17% of the population, their benefits are ending. That is much lower than we would see in other states where more than half of people are losing coverage. And Oregon's actually in 3rd place overall. So for the remaining renewals, there's about 123,000 that are coming up in waves between June and September. I want to start with who's in those groups. The first driver is the people who are in the Oregon Supplemental Income Program. It's a specific OHP program that provides OHP coverage to people who are either blind, have a disability, and or are over 65, and also have limited income and financial resources. So a specific subset of OHP there. There's also some people that were in a household of more than one person whose benefits were restored and whose renewals were scheduled as part of a federal request to review the automated renewal process for households with more than one person in them. Then the plurality of the 123,000 is not either of those groups, it's their household members. So there's a lot of people who are just falling into that because they have someone else in the household with them who is in one of those top 2 groups. So that's kind of who's coming up over the summer. Other important point is that the 123,000 number there is only including the people that have not been through a renewal since the beginning of the unwinding process in April of last year. There are also some people coming up at this point for their annual renewal again. We are in the process of switching to 2-year renewal cycles for most members, aligning with their continuous eligibility periods. But there are some programs that will not have continuous eligibility. There's some certain long-term care programs, and OHP Bridge will be another example, where people will still have a renewal every year. Some of those renewals are coming up again since we started this off last April and we're into May now. Though we are taking steps to delay those renewals to prevent unnecessary renewals wherever possible. So those are in much more limited numbers than they were previously. But we wanted to clarify that this is just the people who are affected by unwinding that we're referring to in that 123,000 group. That's going to kick off in 4 waves. They're split somewhat evenly between these, not entirely, but that first wave is going to kick off in June, so it'll be like middle of June or so is when those letters will arrive to members. And then they're going to continue having the same timelines we've been giving people throughout the pandemic emergency. They give them longer than any other state to respond. They've got 90 days at least to submit the response. So if someone gets a renewal notice in June, they have until the end of September to respond to it. If they did not then respond, they would get a termination notice that would close their benefits at the end of November. Even if they missed that date, if they hadn't responded, they could still provide the information they're missing or provide that response to us and get their case reopened without a new application all the way through the middle of February 2025. So many people who have been through the unwinding process so far, the initial 10 waves and whatnot, are still in that 90-day reconsideration period, though that's passing for people. You can always reapply at any time, but we really want people to connect with us even if they miss that renewal due date and get that information in and hopefully keep coverage if they're still eligible. So we've got those 4 waves going out. The first one will be in June, and then they're going to continue through September. We do see that the population that's going to be going through the renewal process in those waves is going to be somewhat different compared to the overall OHP population, though. In no small part due to that OSABM group. Higher numbers of those members are over 65 or disabled. Almost 2/3 of them have a disability of some form. That is self-identification, not long-term care or anything. But we see that there's a disproportionately older, disproportionately more disabled group going through these renewals. Other point here is that many of these renewals were restored and had previously closed or downgraded to a Medicare savings program. So we restored their benefits so that the notices could be updated to provide more information about their reasons for closure, and so members can make informed decisions around that. If their income and financial resources have not changed, we would expect the same outcome to happen quite frequently. So updating those income and financial resources and helping people respond to renewals is going to be one of the main action items coming up over the June to September period. We will have some more resources about how to answer these sort of questions and where to point these more complicated questions to coming up in the near future in the June meeting and whatnot. The other point we wanted to draw is that we are intentionally spreading out these renewals in order to allow for extra support for this population. Since they're more likely to have disabilities or authorized representatives or long-term care benefits, we really want to make sure they have the additional capacity, or our workers and support networks have the additional capacity to reach these members. The total population of 123,000 is less than a single month of our renewals earlier in the unwinding process. At 25 to 34, that's like a quarter to a third of what we would be seeing earlier in the renewal process. So we've slowed down the renewals significantly in order to give these people more time to respond and give the case managers, if they have them through their long-term care services, the capacity to reach out to them and help with that process where possible. Other thing that's been happening there is that the renewals in June are going to start looking a little bit different. We've got a big system update coming up on May 15th that will affect the renewals that start to go out in June. So the June renewals will be the first time you see the new notices and whatnot. We shared examples and went into more detail in this section in the morning partner webinar. We'll put links to the recording in the chat or post email since that's available, where you can learn a little bit more about this side of things. One of the big points we wanted to draw here, though, is that this was a big response to feedback we got from people like you early on in the pandemic about a year ago. A lot of responses found various aspects of our renewal process confusing, but particularly the notices were difficult to understand and hard to find the relevant information in. Members also needed more information about the reasons for closure. They found the sheer number of notices that they sometimes receive overwhelming. There were also some common points of confusion that happened when people got a renewal approval as well as a request for information that could be split across 2 different letters, and people generally found the communication around that situation quite confusing in the notices. There was also people who were losing coverage did not receive a window to respond and were less likely to receive the mail if it got misdelivered or other things like that. So we also got some feedback around that topic. Other big driver of the system update was a response to a federal government request for 30 states to address an issue with their passive renewal process for households. In combination, we've taken a bunch of steps that are described in the next few slides to make the renewal process work better for all of these things. And it has taken a year to get this happening, but also we are listening to all your feedback and really value this. So a lot of the comments that folks like yourselves expressed, often in cases literally some of you, is getting turned into system change here. And I really wanted to drive that point home that we do listen to that, really want to value that feedback. And we're wanting to continue this webinar space as a place to hear that from you and be able to know what we should be doing to benefit members down the road, even if it takes time to make that apply to the system broadly. When we can make that happen, it really has an effect. So just reinforcing that. So we've got a few broad categories of changes that are upcoming. The first one is the one system changing for renewals and updating to handle passive renewals individually instead of by case. That will basically, when someone goes through the renewal process, we try to renew them first automatically. If they aren't able to get that information verifiable, the whole family would have to respond, including the members of the family who could have kept coverage through that automated renewal process individually. In order to not close those people, we had to review that change along with 30 other states there. We've also got some changes to the medical renewal process. We're no longer allowing terminations or reductions without providing the individual a chance to review and confirm the case information, for instance, if they're over income. Actually happened to my wife. She didn't get the notice from OHP at all. The marketplace letters arrived and whatnot, but in that situation, it was less likely for folks to know what was happening and make the jump to the next coverage option. So we really wanted to make that change to the system to allow more people to get to their next coverage home. We've also got a bunch of changes to requests for information at renewal and how they are treated that should hopefully make those situations I was referring to where the 2 letters would arrive far less common and easier to understand when they do happen. There's also a bunch of notice improvements coming up. The notice will still look vaguely familiar, but there are some changes to make them much easier to read and put information up front. There's a page 1 summary that's color-coded that I particularly like the new capabilities of, as well as we are consolidating that all into one renewal notice that replaces the previous passive and active renewal notices. We're getting rid of the old blank renewal packet, for instance, and moving to this one consolidated notice going forward. So a lot of changes there. On that design notice point in particular, we moved everything up to the front page. So there's now a front page section that reads out for the whole family what the basic summary of what's happening to their benefits. This person is approved, this person needs to respond, that sort of thing, and it's color-coded, which is particularly nice. Then there are individual extra details sections for each of them, resulting from the change to handling this on an individual level. We also just reduced the number of times that eligibility notices will trigger after reporting a change. If it doesn't affect your eligibility notice at all, we're going to stop sending extra eligibility notices after reporting an income change or something like that. So hopefully that'll affect some of the overwhelm and help people focus on the notices that we do need to send. There's also some new changes to focus on benefits level, like OHP, as opposed to the program specifics, like Magi Adult, Magi Child, Children's Health Insurance Program. Those differences don't matter as much to members as they still have OHP. And when people move between programs, that gives us the functionality to explain that they are staying on OHP rather than changing benefits. We've also added more information about when people are closed. We've added more information about why they're closed. That includes the specific income limit they're being compared to for their family size and the income on file that's on file for the case. So hopefully it's clear why they're being deemed ineligible for income reasons and whatnot. And they can, if there's a error in the information we have on file, it should make it clear that they need to correct that. So a bunch of exciting changes there. Do we have any questions in the chat before we move on to other topics?
Does not look like we have questions in the chat yet.
There are some notice examples in there that I find very exciting personally that were shared in the morning webinar. Feel free to refer back to those slides if for the recording if you want to learn more about that topic. Otherwise, we'll be moving on to the plan for these future webinars. So starting in June, we're going to call this Oregon Health Update. It's going to be a continuation of this webinar series, this office hour series, combining with the webinar that we had this morning, merging those into one and upping the frequency to monthly. We've got a lot of changes coming up in the near future. We want to have that regular both feedback opportunity and opportunity for you to ask questions with the program experts here with us. So intent is for anyone working with members really to be able to ask questions, make suggestions, and share your feedback. So hopefully we can collect more of that feedback that resulted in all those system changes to the renewal process. We really value having that direct connection and hearing what's happening on the ground. Upcoming months are going to heavily feature both the remaining unwinding renewals that we just shared information about, as well as OHP Bridge, which is going to be one of the main things happening in the next few months. We've got the team here today, and that'll be the next topic we'll be going into there. But we really wanted to frame this as an Oregon Health Update series that allowed for all the updates that are happening to the health coverage landscape, whether that's the upcoming waiver climate benefit that launches in November and open enrollment season. There's always something new newsy that's coming up, and we wanted to keep this series going so we can continue that connection beyond the unwinding. A lot of overlap with those other projects as well, so it just made sense to collect that information in one place for your radar. That way you can learn more as appropriate and get directed to all the other things that are happening. So we're going to welcome Tim Sweeney. I believe you're going to be speaking for the OHP Bridge team today. We've got an overview of what's coming up there, and then we'll be heading over into some feedback. We'd like to hear from you about how we can make this effective. So, Tim?
Yeah, great. Thank you, Sean. Happy to be here. And just since it's been a minute, we'll start with a bit of just a high-level background and a couple of updates. So I think the next slide. I think we always like to remind folks what OHP Bridge is, just in case folks are new to these conversations. So this is a new benefit for adults, 19 to 64-year-old adults with income up to 200% of the poverty level who are not eligible for Medicaid. We are using the basic health program template through CMS, through the federal government for funding. So some folks may be more familiar with this as the basic health program, but as we'll talk a little bit more, want to make sure that we're shifting to the appropriate branding of OHP Bridge. A couple of caveats and where this is sort of eligibility is different than Medicaid. Folks, again, up to 200% of poverty, 19 to 64, cannot have access to other affordable health insurance coverage. That is the same affordability definition that is present for folks' eligibility for tax credits on the marketplace. And then they have to have an eligible citizenship or immigration status. And again, this is an area where it's akin to the marketplace definitions for what constitutes eligible citizenship and immigration. Coverage is almost the same as OHP Plus. There's really just a couple of differences, namely long-term services and supports and health-related social needs. And like OHP Plus, it is free. There's no premiums, no member copays, no deductibles. So over the next, beginning in July 1st, when the program goes live, folks will move into, will enroll in OHP Bridge from a few different places. Starting at the bottom here, the first one, the first phase, if you will, is folks moving directly from the Oregon Health Plan who've already been identified as having income in the OHP Bridge range. And who have been on what's been called the temporary Medicaid expansion since going through their redetermination until the program launches. And these folks will move on July 1st. Over the course of the next couple years, people will also move from the marketplace or enroll from being uninsured. We think that somewhere in the neighborhood of 35,000 folks will be eligible to move from the marketplace to OHP Bridge, but that won't happen automatically. That will take action on their behalf, and so that that migration will happen over the course of 2 or 3 years. And then similarly, folks will have to apply if they're uninsured, and it will be the same application setup as for OHP Plus. And so we do expect some folks to start enrolling in the program this summer and over the course of the next couple of years. Again, I mentioned that this has often been called the Basic Health Program, but some folks may be more now familiar with the new name OHP Bridge. This has been presented in lots of other avenues of partners, and so some folks may be more familiar with it than others. But OHP Bridge is the benefit name, and in Spanish it's Puente a OHP, and in the MMIS system, it will be the OHP Bridge or the BRG benefit. And a reminder that there are 2 programs as part of this. One is through the Basic Health Program, Section 1331, Basic Health Program Blueprint, and that will serve the majority of folks who are eligible for this coverage. But also there is authorized by an amendment to our 1115 waiver, what's going to be called OHP Bridge Basic Medicaid, and this is to enable American Indian Alaska Native members who are in this income range and meet the eligibility category or criteria to retain their right to opt out of mandatory managed care enrollment and enroll and be covered through Open Card. So the OHP Bridge Basic Medicaid is our avenue to create that. As I mentioned, the program launches soon. It starts in July. People who are moving from OHP Plus will get a couple of notices. First, in the middle of June, they will get a notice about this upcoming transition, that their coverage will shift to OHP Bridge in July. And then at the end of June, when the system changes go live to enable this, there will be another notice that comes out that tells them they actually did move. There will also be other notices to tell folks who are not going to be eligible for OHP Bridge, but who may be on the temporary Medicaid expansion, to tell them that they're not going to be moving to OHP Bridge, and that they have the 60-day adverse action period. So if there's additional information that they tell us that would say that they are eligible, for instance, they would be able to move, but otherwise their coverage would go through the end of August. And an example of that is somebody who's on the temporary Medicaid expansion, but who also has employer coverage. For instance, that's a criteria that in the eligibility for the program, it's not for folks who have other access to coverage. And so if we already know that they have affordable coverage somewhere else, they would not move into OHP Bridge. New members will also get information from their CCO directly. There's going to be an OHP Bridge insert in member handbooks, and there may be other communication, but members will be able to use their same ID cards. So a couple of updates we thought y'all might also be interested in. First, on the contracting side, the final contract has been sent to CCOs, and in advance of that, they received a draft and were able to offer feedback, and as part of that process, signed letters of commitment. And so every single CCO signed a letter of commitment to participate in OHP Bridge, and we expect their formal signatures on their contracts by the end of May. Rulemaking is also nearing the end of this process, and as part of it, the OHP Bridge team gave dozens of presentations to CPOP collaboratives, and we held a RAC in February and a webinar shortly after that to go over the rules changes, both the new OHP Bridge specific rules as well as edits to existing rule that defines folks' eligibility for different programs and how they work, and then an extensive public comment period. they're undergoing just the final stages of formal structure and before getting sent to the Secretary of State's office for effective date of June 1st. And then I think this is maybe the pivot to sort of what Sean was alluding to in terms of some conversation about our continued interaction with y'all and how we want to sort of streamline and formalize a process for being able to take questions and feedback and get answers back in a more streamlined and widespread way, as opposed to sort of just getting kind of one-off questions when folks have our email addresses or happen to be at the right meeting. So what we're shifting to is this a setup where folks can submit questions, can get questions to the OHP Bridge team and to various parts of the agency working on these issues through the OHP Bridge email, through Rocks, and by attending monthly office hours, by attending these meetings. So we will plan to collect questions via all these avenues, and then work internally to make sure that we have the right folks answering them, especially since a lot of these questions, while being mostly about OHP Bridge, are connected to broad OHP Plus operations or have answers that may require more nuance than just what the Bridge team can sort of offer on the fly. And as we collect those questions and have time to get answers, we'll then share the answers back during these office hours each month, so everybody else can also see what questions have been asked, and so we hopefully help limit how many times we're asking or we're answering the exact same questions, and then also make sure that we're answering it in the same way for everybody. And then written responses will also be sent out following the office hours, so that folks who pose the questions have a written response that clarifies that as well.
Looks like we've collected some questions in the chat. We've got a couple more slides
Sure.
about the materials that are coming up, and then we'll get to those in just a second.
Great, thanks, Sean. So there will be, and I may also defer to a couple folks who know some more specifics about these, but there's both, we're working on partner trainings that will be available on demand starting very soon. May 15th is tomorrow. In English and Spanish, and then an FAQ is available now on the website, and more materials, toolkits and flyers will be available soon. And so also this is just a good way to offer a reminder of the OHP Bridge website in English and Spanish, and the links are available here. But so these materials are coming very soon to offer a lot more detail about the program than we've gone through so far today. And then partner toolkit coming at the beginning of June, and that will have even more material specific to the program, including more background information, key messages, and other resource documents.
I think that's it for this section then.
It is.
We've got the next one coming up about the ad campaign plans and things like that. So we'll get into more about that in just a second. But it looks like we got some questions about Bridge itself that we could address.
Yeah.
I think the first one was just to clarify when that new organ health update series is going to take place, the time and day.
I believe the next meeting is June 11th.
Okay, and then we have, is this an automatic move for those who qualify and enrolled within these programs?
So the move will be automatic for folks who are on the temporary Medicaid expansion or who then will go through the redetermination process this summer and be identified as OHP Bridge eligible. So people moving from OHP to OHP Bridge that will be automatic. If they'll be determined eligible, just as if they're moving from one eligibility category to the next. It will not be automatic for folks who are currently covered via marketplace plans. In order to move from the marketplace, for folks who are enrolled in a marketplace plan, it would require them to do one of two things. First is if they updated their marketplace application, say as part of open enrollment, they have a new address, they have new income, they go in to pick a different plan, they update their information and are identified as in the OHP Bridge income range. Healthcare.gov, the marketplace will send their application to the one system, just as if it was identifying them as Medicaid eligible instead of tax credit eligible. Alternatively, if folks want to go directly to the one system, that is also another pathway for somebody who has marketplace coverage, could just go straight to a one system application. And of course, wherever they're working with assisters and community partners, if they're working with somebody on their marketplace application and regularly work with them to update their selection every year, for instance, that partner, that assister would be able to help them connect to OHP Bridge.
And then will there be an updated income guideline that they can reference?
That they can reference, meaning partners, is that whom
Partners, yes.
Yes, that will be I believe that is part of the resource and training materials, is more information on that.
I believe CPOP's handling the update to the CPOP income guide. The marketplace is doing the same for the marketplace one, which is the main one we use publicly. It's also on the OHP Bridge website right now. If you go to the ohp.oregon.gov/bridge, it'll have that current income limit thing just for Bridge on that one.
And I see a question about the preview of the letters that will go to members in mid-June. I am not certain that I can answer that right now. I would need to either defer to folks who are in this meeting or take it back, because I'm not familiar with how that normally works in terms of sharing those sorts of letters. But Sean, you kind of look like you have something to say.
Yeah, our anticipated being able to share those data is sometime in the first week of June. So we have the requests in; those will be available to you as soon as we have them ourselves, the finalized versions.
Go to the next question. Currently, the expanded adult program is only available for individuals who have met the 5-year bar for OHP. Am I hearing that the basic bridge program will be eligible to anyone who has an eligible immigration status who could purchase a plan through the federal marketplace, now including DACA?
So OHP Bridge Basic Health Program will be available to folks who have a status that would qualify them to get marketplace subsidies. It is the Basic Health Program, or OHP Bridge BHP, does utilize the marketplace eligibility status definitions that then don't include the 5-year residency requirement. So in short, yes, folks would be able to get OHP Bridge BHP if their status qualifies them for marketplace tax credits. As it relates to the future changes to DACA being a status that would enable somebody to get marketplace tax credits, that new federal rule also would apply to Basic Health Program, so apply to OHP Bridge Basic Health Program. We are just still working as a state to sort of like better understand all of those moving pieces and better understand the system changes that we need to be ready for that.
And if I can jump in on the expanded adult part, I think people who have expanded adult has used the same immigration rules as Healthier Oregon, correct, Tim?
The temporary Medicaid expansion, no.
Okay.
There's not a Healthier Oregon component to that. There's not a state funded piece to that.
So they would have lost coverage during renewals then, if they didn't meet the 5-year bar and whatnot.
Yes.
How will you know if a new applicant has access to TPL? I'm assuming there will be a new question added to the online application.
Yes, there is a question added to the online application for them to, for applicants to be able to say, yes, I have access to other coverage, or no, I don't. And if they do have access to other coverage, there's questions about what that coverage costs and their income, so that the system can make the calculation as to whether that coverage is meets the affordability is above or below the threshold to determine whether it's affordable. If it is not affordable, then the person would still be eligible for OHP Bridge. If it is below the threshold, the affordability threshold, thus it is affordable, they would not be eligible for OHP Bridge.
I think we have one last one for the time being. Will OHP Bridge members be eligible for HRS Flex Funds and HRSN?
So health-related services, HRS, is part of the is available to OHP Bridge members, just like in with the caveats, right, that it's not a defined benefit, but it is an allowable service for CCOs to deliver to OHP Bridge members. But health-related social needs services are not part of the OHP Bridge benefit package at the moment.
I think that's all the questions for it.
Thanks, Jordan. We will
Great.
move on to the campaign plans then. So we want to take some time to get some feedback from you on how the keep covered materials during the unwinding have worked so far, and how we can apply this to our future outreach efforts. We're going to be describing the OHP Bridge and general health coverage campaign plan that's coming up, and wanting your feedback on materials that we had in the unwinding, and wanting to kind of get the lessons learned from those and apply those forward. That's the intent of this section. So some background context here. As Tim was explaining, most of the people who are going to be eligible for OHP Bridge will transition either from the OHP or Marketplace. Those people need less outreach, since either the transition will happen over time in the case of Marketplace, or it's going to happen automatically for the OHP members. Survey data on the uninsured estimates there are more than 135,000 uninsured in Oregon who are eligible for one of our programs prior to OHP Bridge. That 2021 Oregon Health Insurance Survey estimated there were 38,000 people who were eligible for OHP Plus and had not applied or had otherwise not connected. There were also up to 97,000 Marketplace eligible uninsured, which would also include the OHP Bridge members that we're trying to reach here. Since people who are not on any of these programs yet generally aren't going to know which program they're eligible for until they apply, the process is really how we figure out what you're eligible for. Due to that uncertainty, we're proposing a broad outreach campaign that will try to get uninsured folks covered by whatever program they're eligible for out of these. So that's kind of what you're going to see here. We've got those Bridge-specific materials for partners that are part of the OHP Bridge Partner Toolkit. And then we've got this outreach campaign at the uninsured that's going to be kind of taking a broader lens that you'll see upcoming here. So our proposed campaign message is health coverage, get it, use it, keep it. The main action there is apply for coverage that we're asking people for. So the focus will be kind of on the get it portion of that. This is kind of a rebrand extension of the whole keep covered materials message you've seen previously, trying to adapt it more to the outreach focus we're seeing here. So the get it messaging preview that we've got here is that ways to get health coverage in Oregon are expanding. There are two options depending on how much you earn. Oregon Health Plan is free coverage. More people with higher income now qualify. The Marketplace offers free private coverage from companies, and I'm sorry, I can't see the word here from the way my screen's displaying. I think it's 80% of enrollees get financial help is what I remember that being. And then The call to action there is find free help and learn about your options, driving to oregonhealthcare.gov in most instances, though for a lot of partner materials, we really wanted to focus the call to action on getting help and making it so y'all can slot in your contact information, your website, whatever the best place to direct your clients to. That way you can take over that call to action to get connected with yourselves as well. There's other two components to this are the use it portion and keep it, which refer to actually using health coverage and taking the actions like reporting changes to keep your coverage going and stay on coverage once you get it. So as I'm sure all of you are aware, getting health coverage itself isn't really the goal. It's actually to get that person the health services they need to reduce their healthcare costs, keep them healthier long term, whatnot. Really trying to bridge that gap. Same as CPOP is focusing more on that and the grants and expectations of assisters as well. So we've got some messaging about once you get your coverage, call your plan, use your website to find benefits or to learn about your benefits and find providers. We really want to drive that schedule your annual checkup messaging and calling your plan to learn about and find providers with other services, such as ask about local dentists and mental health care providers, and trying to get those initial connections to the kind of established care appointment. That way the rest of the health system can get them referred out to the specific services they need, but really trying to bridge that initial connection so members are using their benefits once they get them. And other secondary message component would be the keep it thing. That is the most direct extension of what we called keep covered for the unwinding last year. That also is talking about our new continuous eligibility rules a little bit on OHP. Even if your income goes up, your coverage won't end until your next renewal. Continuous eligibility doesn't directly apply to OHP Bridge. It has some similar protections that last for lesser length of time. Go to the OHP Bridge partner training if you want to learn more about that. That's launching tomorrow. But we wanted to message that people can keep coverage between renewals because that's also an important outreach component. If you have temporary income disruptions or a seasonal worker or something, we really want you to get covered and take advantage of that as well. And then we've also just the general reporting your changes protects you. It's important to report income, address, other health insurance changes as well. Particularly relevant to OHP Bridge with all the changes that are happening for affordable health coverage being eligibility requirement. So we do have the whole campaign outreach materials for partners planned as well. That'll be outreach flyers, a rat card, social media posts, key messages following that health coverage, get it, keep it, use it branding, and the general framing of trying to get people to apply through either one of the systems for a program they're eligible for. They refer back to each other. If they can get that interest going for either one of them, hopefully it gets them the correct system to the program they're eligible for, whichever that is. We'll also be doing ad campaign messaging beginning in July, running for about 4 months. That'll be the same sort of banner ads, billboards, and Spanish outreach versions of those as well that were done for the Keep Covered campaign over the last year. A lot of that's going to follow the same or similar visual style to our Keep Covered campaign materials. Since we're using the same contractor and whatnot, it's all part of the same contract. It's going to be from a similar materials. We really wanted to get your feedback on the unwinding materials that have existed over the last year and hear your criticisms and ideas for improvements and apply those lessons learned to guide this future more outreach focused year. Now that we have less renewals happening this year, we're launching this new program to reach out. So next, we're going to go back a little bit through those Keep Covered materials, get some reminders on there, and then I'm going to ask a bunch of questions and really ask for y'all to chime in with your feedback on these things, and especially criticisms, weaknesses, areas we can improve. We had advertising running through February 2024. You may have seen some of these bean characters on billboards, on banner ads. There were a few videos as well. You can see a whole list of what we did on the right side of this campaign. We also had partnered these posted on like the city buses in Portland and had ads running in the Street Roots campaign to reach houseless members and whatnot. We also had campaign materials, including a poster, table tent, flyers, fact sheets, FAQs. There were a couple of videos as well for use on social media. We also produced customizable options that would allow your agency's logo to be slotted in place of, there's a square in the bottom right of that left one. That also was featured in the partner toolkit, which was more tools specifically intended for partners that you could customize to have an individual event or something that you were running. One of the feedback items we heard about this already was that we'd really like the call to action focused, as opposed to take action being the main call to action here, connecting with help more directly or connecting with the OregonHealthcare.gov site that has that window shopping tool that can figure out which you're eligible for and direct you to which place to apply first. We really wanted to focus the action item in there. But all these materials were intended for partner use. We really want to get your feedback on how useful these were. Did you use them? If you didn't use them, why was that? Was that you not knowing about them, not finding them useful? We want to hear that sort of criticism and be able to apply this to make this campaign effective going forward. So that was our little Keep Covered website. We have the OHP Bridge website already up as well, so we have got a different equivalent for that one. We also offer technical assistance to partners that involved customization of materials for specific things, like one partner wanted to run a drive-in movie theater ad, and I believe it was Northeast Oregon. We were able to customize materials for that and whatnot, and do pop-up banners for events and things like that. I guess general question out of all of this becomes, what was useful to you out of this, if at all? What would you like to see in additional partner materials and toolkits, and what feedback do you have for us on all of this? I have some example questions to keep the conversation going, but if anyone has thoughts to chime in, I would welcome to hear from you all first. Looks like we had someone in the QA.
It was just a question about sending out the slides after this.
So please chime in with any thoughts you have on all of these. I'm going to start throwing some specific questions out of there. One thing I'm kind of foreseeing is that our messaging tends to have OHP's Bridge is going to be available for people with higher incomes, messaging like that. That is a true statement relative to our current OHP income limits and probably makes sense for partners. I'm not sure that makes a whole lot of someone who is earning $24,000 a year or something might not see themselves as having higher income though. For the ad messaging in particular, how do you think might be an effective way to reach that income group? We're specifically trying to reach that higher income population, but if you have suggestions on how to approach that particular nuance in messaging, we would appreciate the thoughts on how to do so most effectively for the communities you serve.
And I would emphasize that last point. You're all experts in the communities that you serve. Is there something missing that you see in these communities that you work with that's needed?
One of the most common reason for not applying for OHP is that they think they're ineligible. That is often because they've applied before. So we're really trying to get those people who have been denied before to know that this is an expansion, to try again. That message probably is different for different subsets of the OHP population. So really just wanting to offer the opportunity to, if there's a specific way to make that message stick with the people you serve, we want to hear that from you. Does anyone who uses the Keep Covered materials at all want to chime in with how those went for you in actual use with members?
Sean, I've used those.
Yeah, Christine.
I've used those materials several times. We have wellness events here at Adapt, and so I hand out the flyers and talk to people about getting their OHP renewed. But then we also have a huge outreach program, and our mentors will go into the homeless camps and use the cards
Mhm.
And I handed a whole bunch out to our mentors so they could make sure they get them into the people in the camps.
And that's referring to we made some waterproof cards that had some messages tuned to homeless outreach. For instance, if you didn't have access to an address, we had some language about that on that. So it sounds like that was particularly useful.
Yeah, it was.
Thanks for that. Do you have any suggestions on how we could, at initial impression, the homeless community is less likely to qualify for OHP Bridge compared to other programs, though there definitely will be a aspect of that. That's a pretty nuanced take of how to best reach higher income homeless people. Do you have any suggestions on that, Messenger?
Oh, I didn't think on that one.
We're working on it too. How about folks who didn't use those materials? I'd really appreciate to hear the negative feedback as well, and areas we can improve, or areas you thought there was weaknesses in them. I'm unable to see the chat if folks feel like reading out any comments we're getting there.
Not any specific suggestions, just some people sharing that they've used them at health fair tabling events, the resources that you put out before.
So hopefully we'll be making pretty similar. The flyer and rack card should hopefully meet some of these needs for you, keeping that similar intent there.
And hearing any successful stories is good feedback too, for us to know which directions actually work as well.
Well, please let us know as this campaign rolls out how you're experiencing it on the ground and whatnot. We want to continue to adapt this as we have it going live. If you have any feedback on what would work better, what isn't working, we really want to hear that as well. So at least this webinar series will be ongoing monthly to give you a regular opportunity to provide this sort of feedback. We really value that and want to turn that into long-term improvement for members. We recognize what it takes having such a network system with so many partners outside the agency. We really need to be working together, and hopefully this will be a venue for us to continue that sort of conversation and make sure you know that we're listening to you on all this sort of thing, and want to value you as partners in this, in creating these things as well. So I think that's pretty much the end of our agenda for today. I do want to open it up to additional discussion items if folks have other things that are just top of the mind for you and your members at the moment. We always welcome to hear feedback on other topics too.
Looks like we have one comment in the chat that says maybe make the campaigns more personable. For example, Jane has really struggled with XYZ and thought OHP may help, but they are always over the income limits. Now she applies, here's why.
So personal examples, it sounds like, or story vignettes, or like the idea.
It looks like that's all we have in the chat for right now. Looks like we might be able to give everybody about 5 minutes back. If that seems like we've wrapped up for today, I'll leave it open for any last questions or comments. I did pop a Menti in the chat because I know everyone loves surveys, but if you could just take this quick one to help us improve these office hours, that would be great.
Jordan, there's a question in the Q&A too.
Oh, sorry, missed that one. Oh, okay, here we go. I have some clients who have an immigration status but did not qualify for the expanded adult program because they did not meet the immigration bar. Is there a way of running a report and sending out a notice to those individuals and encouraging them to apply again to see if they qualify for the Bridge program in July?
My first reaction is we might want to see some of those cases as to what's happening with the 5-year bar specifically there. Tim and Laurel, do we still have you here?
Yeah, I'm still here. I mean, I I think that sounds fantastic. I don't know what the system capabilities are for us to be able to do that, to like identify folks who were not, but folks in this situation, right, who were on OHP, weren't able to move to the temporary Medicaid expansion because of the 5-year bar, and thus who lost coverage.
That-
Folks in that scenario would have been eligible for marketplace coverage. So I don't know, folks who did that may come back to OHP Bridge when they update marketplace plans at the end of the year or something like that. Sorry, Sean, you were about to say something.
I think this is a great one for a written answer. We'll get more information about how MAGI expanded adult immigration eligibility works and OHP Bridge immigration eligibility, and we'll also investigate what we can do to reach that. The state is doing what it can to support future expansions of coverage to immigrants. So I think this would be valuable for us to look into regardless.
Great. Okay, it looks like we're all wrapped up for today. Thank you for joining us, everyone. Thank you to OHA and ODHS for presenting and being the subject matter experts. And there will be a follow-up email going out that will have resources from today's presentation. So thank you.
Thanks so much,
We'll see
Jordan.
you next month. Bye.